Okay, hi, my name is Ella, and this is my subcutaneous injection validation video. Just to start, we're going to look at the patient chart. My patient today is Joanne Peterson. Her date of birth is 12/10/47. She has no allergies. She's a high fall risk, and she's a full code. It says here that she is on the medical surgical unit for an admitting diagnosis of dehydration and a fall after being found by her son at home. She has a past medical history of hypertension and asthma. Her medications include furosemide, albuterol, and acetaminophen. She lives alone at home, has 2 children. Her son lives next door and her daughter lives 5 miles away, and she's a retired accountant. Her weight is 145 pounds and her height is 5'4". I'm making a note of the weight and height based on the subcutaneous injection that I will be giving later. Looking at the handoff report here, her vitals look normal. Everything looks normal. She's high risk for falls, like I said earlier, and she has soreness from falling, which is to be expected. So then moving over here to the MAR, I am noticing now, I had previously given her Fluzone, and I'm noticing now that she has her heparin that is next due now. So I am going to get that ready for her. So to start, I'm just going to be doing my first med check with my heparin. So I have heparin, 5,000 units, 5,000 units per 1 milliliter, 1 milliliter, and I have a syringe here, 1 extra syringe. I have a syringe here that can be drawn up to 1 milliliter, so that's good. I just do now. It's for my patient Joanne Peterson, and the indication is there since she had falls. She's a high fall risk. She's going to be most likely in her bed a good amount, and since she's in the hospital, we want to give this to her just as a preventative measure for blood clots. So the indication is also there. So now just to start, I'm going to get my supplies ready. Okay, so just to start, I'm gonna scrub the hub of this for about 15 seconds and allowing it to dry. And I'm going to prep my syringe and my blunt tip needle. I'm going to connect this here. And I'm making note here that it's 5,000 units per 1 milliliter, so I'm going to drop 1 milliliter of air, and I'm going to inject that into the vial, and then flip it and draw up that 1 milliliter without getting any bubbles. Perfect. And then I'm going to safely recap this with the scoop method. So you can see here, there is 1 milliliter, so that's perfect. And then I'm going to do my second check now. So I have the heparin. I just drew up this heparin in the vial. So I have heparin, 5,000 units, 5,000 units. In 1 milliliter, I have the 1 milliliter right here. This is a subcutaneous injection. So I have here a 5/8 inch needle for that subcutaneous injection. It is next due now. It is for my patient Joanne Peterson. And the indication is once again there because when you're in hospital, it is like a standard precaution to have some to be giving heparin to prevent blood clots. So that is that. I'm then going to switch over this to the actual needle that I'm going to be using, and I'm going to make a note here that with this needle, since it is subcutaneous, I'm going to be using a 5/8 to 1 inch needle, but I'm going to be using 5/8 inch today in length, and then I'm going to use 25 gauge for my subcutaneous injection. And then I'm also going to make a note that I'm going to inject the subcutaneous injection at a 90-degree angle based off my patient's weight and height. She has enough weight where she's not super frail and thin, and I'm able to do that at a 90-degree angle in order to access her fat. Good garbage, let me throw this away. So next I'm going to go into my patient's room, do my third check up on them, and yeah, so I'm gonna head into the patient's room now with all my supplies. Oh, before I do that, I'm taking my label that I made, my heparin label, And I'm labeling my syringe. Now I'm going to enter the room with my labeled syringe. Knock, knock, knock. Provide privacy. Hi, my name is Ella. I'm your student nurse today. Can you verify your name and date of birth for me, please?
Joanne Peterson, 12/10/47.
Perfect. Hi, Joanne. How are you doing today?
I'm good.
That's good. So I'm here today because I see here on your MAR that you have heparin that is scheduled to be given now in a subcutaneous injection. Heparin is just kind of a standard precaution that we give in the hospital since you are a high fall risk and you're going to be in your bed a lot. We just want to make sure that you're we keep all the blood flowing smoothly. We don't want any blood clots or anything. So this is kind of just a preventative measure to make sure that you're healthy and safe. So that's that. And this is going to be a subcutaneous injection, which basically means that I'm going to inject it into your fat. So, before I begin, do you have any allergies?
No,
Yes.
not really.
Okay, yes, that's what I also saw on the chart. So, that's wonderful. All right, let me get... Another thing, Joanne, is I can give this to you at a couple different sites. I can give this to you on the fat, on the back part of your arm. I can give it to you on like kind of your flank here. I can give it to you in your leg, and I can give it in your like abdomen, your lower abdomen. Which would you prefer?
If you can just give it on my stomach, if that's how it's administered, just do it there.
That's probably good. That's the best absorption rate is in the stomach too, so we'll do that, especially because there's a lot of fat down there. It should hurt a little bit less. Won't feel a pinch as much. So now I'm going to be doing my third medication check. I have heparin, 5,000 units per 1 milliliter. 1 milliliter. This is a subcutaneous injection, so I have a subcutaneous needle that's 5/8 inches and 25 gauge, so that's good. It is next due now. It is for my patient Joanne Peterson that I'm here with today, and then the indication is there because we want to make sure, we want to prevent blood clots since she has a hospital stay and is a fall risk. So that's great. Okay, Joanne, I am just gonna move back this up a little bit and expose your stomach here. And make sure to keep everything else covered up and just expose your stomach. All right, and I'm just gonna clean this with some alcohol. Move around in circles. Perfect. I'm gonna let that dry. Okay, and then I'm going to squeeze your skin here a little bit and go at a 90-degree angle and inject this. And I'm going to apply pressure and do the safety on my needle here. There we go. How are you feeling, Joanne?
I feel okay.
Okay. I'm just gonna cover you up there. And then, Joanne, with this medication, since it does make sure that your blood is flowing very nicely, if you have any like bleeding or any bruising, that's pretty normal. But if you have any excessive bleeding or bruising, please let me know. But just be aware that if like you go to brush your teeth and you notice a little bit of blood, that's totally normal. Because this medication does make you more likely to bleed. So just so you know. Is there a better? Okay, I'm gonna go over to a sharps container that's actually set up over here. There we go. In the patient's room still. All right, Joanne, so, yeah, like I said, if there's any excessive bleeding or anything, please let me know right away. If there's any weird bruising, please let me know right away. I'm gonna stay in here for several minutes just to make sure that you're still feeling okay. Okay, so several minutes have passed. Are you feeling okay, Joanne?
Yes, I feel great.
You feel okay? Okay, that's great. Do you need anything else from me? Do you have any questions right now?
No, but I don't have any questions. I feel pretty good.
Okay, that's good. I'm just gonna make sure your bed is in the lowest position. And here's your call light right here. Do you have anything else that you need before I head out?
Nope.
Okay, perfect. All right, I'm gonna take my supplies and leave the patient's room. Provide privacy. And then I'm going to document my med administration and that the patient is fine. And I stayed with her for several minutes and she is doing good. So